So, Dr. Boy, it is the first time that you came to Hungary to introduce naprotechnology for the Hungarians. Could you say a few words of this visit?
Well, I'm delighted to introduce naprotechnology to Hungary. I think it's a great thing to be able to bring to a country and explain that there's a new medical treatment available for couples who have problems with repeated miscarriages or infertility. And what I think personally is so exciting about this system is the potential that it has to identify couples that are at risk of infertility and miscarriage even before it happens to them. So if a couple uses this for family planning and they use it for fertility awareness, they can assess their gynecologic health even before they try to get pregnant. So it's not just about getting pregnant, it's about having a healthy pregnancy and a healthy baby. And it's a new advance in the world of gynecology, and I'm delighted that it's coming to Hungary.
Was this approach not known earlier, or is it? What is new in this approach?
What's new about this is what's new about the approach with naprotechnology is our ability to optimize the female cycle preconception. And if you get an optimum cycle preconception, then the pregnancies go much better. So it's a new approach, and it still needs to be published in scientific peer-reviewed medical journals, and until that happens, the broader medical community will not accept this. But already we know from our clinical experience, even before the publications are available, this is something that works in clinical practice. So until the published evidence is available, the rest of the medical community is going to take a little longer to embrace this and make it available worldwide.
And in which countries does it work already?
Already, it's working in Ireland, the United States, the United Kingdom, Australia, Nigeria, Poland, and to name a few.
Thank you. And what are the results that you can show?
Well, the results are that couples that are, say you start off as a single person, single women who have long irregular cycles, premenstrual syndrome, who just don't feel well, we can improve their general health. Then couples who experience problems with infertility and miscarriage, on average, we get success rates between 40 to 50%. Even those who have had failed in vitro fertilization, we're getting a 30% success rate. We've also observed there are groups of people who don't respond very well to in vitro fertilization, such as those with reduced ovarian reserve that are close to the menopause. We can treat those very effectively because we only need one egg. So older women in particular seem to do very well with naprotechnology.
On this speech now, where many Hungarians came, there were several questions. They were asking whether naprotechnology can help with men who face some problems.
So naprotechnology can help any couple that has a fertility problem except those who have a zero sperm count or zero sperm motility, those with completely blocked fallopian tubes that cannot be surgically reconstructed, or those who have established menopause for 1 year. If somebody is close to the menopause, has one blocked fallopian tube or a reduced sperm count, we can actually help those. We can also help with endometriosis, polycystic ovaries, low progesterone, abnormal postcoital test, practically every other fertility condition we can treat effectively.
Because identifying all these problems, you can treat the problem and then the fertility.
The interesting thing with naprotechnology is that we've got a broader range of diagnostic categories than just those, because in addition to the traditional diagnoses, we also find chronic low-grade infections. We find things like adrenal fatigue, endorphin deficiency, dietary and nutritional factors. And if we combine all of these things together with our hormone treatment and surgical treatments, we seem to get better results.